What is the difference between STAT and PRN, or QID and TID? If you're a Japanese healthcare professional aiming for a global career, you must know these. Today, in our final part, we cover everything from pediatrics to X-rays, including those tricky medication frequencies. Let's finish your professional vocabulary journey.
Welcome back to the Healthcare Career Path Medical Vocabulary course. Keep learning key medical terms and building the skills you'll need for a successful, rewarding career in healthcare. A pediatrician is a doctor that takes care of children. Pediatrics is the hospital department that specializes in the treatment of children. A pharmacist is a doctor who fills prescriptions and gives medicine. A pharmacy is a business or hospital department that provides medicine to people. Pressure is an amount of force applied to a certain area divided by the size of the area. A pressure mattress is a special mattress designed to improve blood flow and comfort. PRN. If a medication is given PRN, it is given as needed. If something is pulmonary, it has to do with the lungs, such as the pulmonary artery. A pulse is an impulse caused by a heartbeat that can be felt when an artery is pressed. If a medication is given QH, it is given every hour. If a medication is given QHS, it is given at bedtime. If a medication is given QID, it is given 4 times per day. If a medication is given QOD, it is given every other day. To quarantine a person is to isolate him or her from contact with others in order to prevent the transmission of contagious diseases. A radiologist is a doctor who takes X-rays and examines them. Radiology is the hospital department that takes X-rays of people and examines them. Rescue breathing is a first aid procedure involving providing air for someone who has stopped breathing but still has a heartbeat. The respiratory system is the human body's means of receiving oxygen through breathing. It includes the nose, mouth, and lungs. The rib cage is a structure of bones in the torso that frames the chest. A route of administration is the path by which a medicine is taken into the body. RX, treatment, is the specific drug or course of action prescribed to treat a patient's medical condition. A sharps container is a box for the storing of used needles and other sharp medical instruments before disposal. Shock is a medical emergency in which the circulatory system cannot provide oxygen to the body. A shoulder is the joint between the arm and the upper body. A shoulder blade is one of the 2 upper backbones that lie outside the ribs and connect the back to the upper arm. The small of the back is the lower portion of the back, just above the hips. The small intestine is part of the digestive system through which food passes from the stomach and through which nutrients are absorbed into the blood. SOB, or short of breath, is a condition in which a patient finds it more difficult to breathe than usual. If a medication is given STAT, it is given immediately. The stomach is a pouch-like organ between the esophagus and small intestine. This produces acid and enzymes to break down food which enters the body. Subcutaneous, SQ. If a medicine is subcutaneous, it is injected into the fatty layer under the skin with a syringe. If a medicine is taken sublingually, it is given beneath the tongue. A surgeon is a doctor who performs operations on people. Surgery is the hospital department where doctors perform operations on people. A syringe is a device consisting of a needle, chamber, and piston used for injecting liquids into the body. T, temperature, is a quantitative measurement of heat within the body. It can be used in part to gauge whether the body is operating normally. A tablespoonful, TBSP, is a measure of volume equal to the amount a standard tablespoon can hold, or about 3 teaspoons. A teaspoonful, TSP, is a measure of volume equal to the amount a standard teaspoon can hold, or almost 5 milliliters. If a medication is given TID, it is given 3 times per day. A toe is one of the small extensions at the end of the foot. If a medicine is topical, it is applied to a certain part of the surface of the body. The torso is the upper portion of the human body that extends from the neck to the pelvis. To transmit something is to transfer it from one place to another, such as transmitting a virus or other biohazard from one body to another. An ulcer is a sore or abscess which forms in the stomach when the stomach's mucus lining is too thin to keep the stomach's acid from damaging the stomach. A valve is a flap in a bodily system that allows passage of material in one direction but prevents passage in the other direction. A vein is a blood vessel that carries blood towards the heart. The vena cava is one of the two largest veins in the body. It connects directly to the heart. A virus is a small infectious entity only capable of replicating within the cells of living organisms. The waist is the part of the human torso between the groin and the rib cage. A wheelchair is a mobile chair with wheels used for moving a sick or disabled person. If a function is WNL within normal limits, it is operating in a normal range. A wound is an injury, such as a cut or burn, usually to the external body. A wrist is the part of the forearm that attaches to the hand. An X-ray is a visual image of all or part of the body, acquired with special equipment using electromagnetic radiation to see bones and other internal aspects. You have now mastered over 100 essential medical terms. Your global career path starts here. If you missed any part of this journey, click the Medical English Full Course playlist on your screen now. Keep practicing and stay tuned for our next professional series.